Hello and welcome to Voice What presents the great business story transforming India in association with NDTV Profit. I'm Nupur Talwar Suri. At Biorad Medisys, innovation meets precision. This facility manufactures life-saving implants and advanced surgical devices used in critical care. From orthopedic joint replacements to minimally invasive and neurovascular solutions, every product is built with a focus on quality, accessibility and global standards. Here technology is shaping the future of patient treatment. And to talk to us more about what his firm does, joining us right now is Mr. Jitendra Hegde. He's the Managing Director of Biorad Medisys. Hi Jitendra, thank you very much for taking out the time to speak to NDTV Profit.
Yeah.
So Jitendra, tell us a bit more about how you moved in from being on the services side to moving to the manufacturing side. What was that one thing that you wanted to transform in medical equipments that made you take that leap?
In India, till late 90s and early 2000s, it was all dominated by the medical device companies. They were, leading the entire medical devices market. So at that moment of time, I was thinking about why not some product from India should compete the MNCs and reduce the dependency on the import. So my whole idea was, what is a gap? I was looking at the gap. So there is huge potential, no doubt, but the gap was, with the Indian manufacturers, it is about the quality, it is about look and feel, it is about acceptability with global regulatory norms. So this was missing, because if you look at in medical, everything is very critical. If something is not complying the regulatory, nobody will touch your product.
So when you found the gap, you decided to go through the way of acquiring another company and then scaling up. So tell us a bit more about what was the thought process behind that.
So when you start on your own as a greenfield, so it was like going to take another 2 to 3 years. Like I wanted to start something very fast with whatever is available in the market. So reshaping that is far easier compared to starting everything from the from the scratch actually. So I thought, because since I had the understanding of the market, so I thought let us acquire this company, Biorad Medisys. It was having a good product lines in the urology. So urology was much simpler product lines as far as in the medical criticality is concerned. So I thought let's build with the catheters first and then keep expanding to the bigger critical areas. That is what the thought process was.
And how has that expansion panned out? Of course, you started out in Bangalore. Today we are sitting in Pune, in one of the places where you manufacture for global distribution. So tell us a bit more about how that has panned out.
Yeah, in 2007 when we started, it was only the urology product lines and only the entry level consumables. So then we thought you have to address the larger specialties, not just urology. So as a Biorad Medisys, we have to have other verticals, that is like orthopedic. It is very, very important. And also we have to have neurovascular, and we also have the strokes, neuro and other things like gastroenterology, bariatric, all those verticals, including IVD and all those product lines. So this was clear vision path I kept in my mind. So that's how I started building. So if you look at our transformation from 2007, from where Biorad had started from Bangalore till today, we are having 3 factories and coming up with 2 more factories, one in Pune, very nearby Pune. We are creating an ecosystem of medical devices. So we are building our vision, and that is total our mantra of accessing the global market without boundaries and giving the treatment to every possible person all across the globe.
Right, you touched upon strokes now. There is an ICMR paper which has just come out recently where the government wants focus for healthcare to move towards that. So how are you as a firm addressing that gap?
As a Biorad, we thought of creating all the devices which can be competitive and addressable to the every section of the society. And also, like if you look at today, from the infrastructure side, government is trying to create ecosystem which will address the clinical side of the treatment, whereas the device side, equipment side, we are building end-to-end product lines, which is going to the first in India, and probably it might compete in the global market also. If you look at our products in the stroke, it is going to be the first in the world, and all products are the patented products, and it is first in the world product lines, and it will change a paradigm shift of stroke management.
Right now, you of course began your journey with actually manufacturing equipment and selling it abroad first, and then you brought it to India. So give us a bit more insight into why you thought that international collaborations and partnerships will actually help you strengthen your business before you enter the Indian markets.
We set our vision to become a quality company with the innovation driven technology platform that with quality standard and with the global compliances. So when I create a global compliance as my standard, so what I thought, let me try out my products in the global market first. How is the acceptability? And that also, like when you challenge yourself in the developed market like Europe, or even trying to supply to the distributors of the US, whether it is in private label or whatever, then your real standard is tested. So we challenged ourselves, and that's how we could build our export market, and we are now exporting to almost 60 plus countries globally.
Now obviously you are a great example of how to take your business abroad, but what do you see as the gaps in terms of India becoming a leading manufacturing player at the global stage, and what are the policy changes that you would actually like to see?
India is known as the pharmacy of the world. Also in the COVID period, India has proved itself as a vaccine capital of the world as well, right? So in devices, doctors are always choosy. They never implant a device if that is of going to stay in your body for the lifetime. So they'll always want the product to be meeting all the compliances. It should have the clinical trial reports. It should have the best of the look and feel. Patient outcome is very important. So what I suggest, or rather the quality wise, India should look at not just Indian compliances. They should look at the global compliances. Once they create themselves ready for the global market, definitely they can sell in India very easily. India can become the global hub of device manufacturing as well. Definitely we have the huge advantage of cost advantage of manufacturing. We can leverage those cost advantage with Indian quality.
Right now AI is both a disruptor as well as a transformer for businesses. How are you adapting to it, and what is it that you're doing as a firm to make sure that you can leverage its advantages to yourself?
Yeah, AI is going to play a huge role in the medical, in the application side, as well as in the manufacturing side. So we are using AI in terms of product innovations, and also we are implementing AI in every section of our verticals, whether it is the documentation, whether it is complying with various integration to various manufacturing levels. So I think AI is going to play a huge role even in diagnostic, even in clinical outcome. So even in the imaging. So we are applying every part of AI bit into our equipment, in the back end side as well as in the front end side.
You are obviously looking at technology evolve each and every day. But as that happens, there are challenges that are also coming up. Now, where do you see your company growing the fastest? In which area in the next 5 years?
Our company has always focused on the patient-centric approach. So for us, patient comes first. Like for Biorad Medisys, we always call it is science for life actually. So we always look at how we can make patient's life better. We don't look at particular disease or particular verticals. We look at technology as a platform and how we can keep technology as a relevant and enduring and can be leveraged. Definitely if you look at the global trend, it is more about so bariatric management and about the stroke management and the vascular. So to adapt to these areas for us becomes much easier with our technological investment and leveraging.
Right now, India, of course, is trying to become a major manufacturing hub. There are startups that we read about, we hear about almost every single day. As an entrepreneur, what is that one advice that you would like to give to people who are just starting out?
So what I could say, for the startup environments. So I ask them to focus on the particular segment with detailing, rather than jumping into just on the revenue or just on the trading, because revenue or the top line becomes very important. But if you look at if you have the complete understanding of technology and the relevance of that whatever business you are getting into. So always I always relate business with the integrity and relevance and endurance.
It was a pleasure to have you here with us on NDTV Profit.
Thank you so much. Thank you. Nice talking to you.